This morning, there is new hope for women with ovarian cancer. The American Cancer Society says more than 22,000 cases will be diagnosed this year. But a new study in the journal Cancer finds a common diabetes medication, metformin, may actually help. Dr. Elizabeth Poyner is a gynecologist and cancer specialist. Good morning, doctor. So tell us about this study. What did it find and why is it promising?
This study demonstrated that a very commonly prescribed drug, metformin, that is one of the most commonly prescribed drugs for diabetes, can actually impact a woman's survival once she's been diagnosed with ovarian cancer. The study showed that women who had ovarian cancer who took metformin for diabetes actually had a 20% better survival rate from the disease than women who did not take metformin.
And why is that?
I don't think we know that yet, actually. The study actually begs to begin to answer mechanistic questions, but it just demonstrates a cause, just an association. Doesn't show a cause, but an association. So when we have observational studies like this, or retrospective studies looking backwards, where we can identify associations, then we can begin to look, is there a cause and effect? If women take metformin with ovarian cancer, will they then have a better improved survival?
Do we think it might have a whole series of other applications for other cancers?
Absolutely. Actually, at a recent national conference on cancer research, there were more than 20 studies looking at metformin with different cancers such as prostate cancer, pancreas cancer, colon and breast cancer. So it might have widespread application to many different types of malignancies.
Just from my what is it does?
Metformin is actually a very commonly prescribed diabetes drug.
I know that.
And it inhibits the production of glucose by the liver. Yeah. But it actually may have direct actions on a cancer cell also, because if we look at cancer cells in a petri dish that have metformin placed on them, actually the cancer cells in the petri dish are inhibited from growing. So it may have what we call anti-proliferative effects directly on cancer cells. So this is actually a great demonstration of a drug which may have different effects than which it was originally used for.
I mean, the thing that's fascinating, it starves or does something to that cancer cell so that it doesn't multiply.
It may be acting by that pathway, or it may be acting via different pathways. Right. These studies will then have scientists begin to look at the mechanistic actions of why metformin can
and this is
survival.
The new way to try to combat cancer.
This is a new way to combat cancer. This is a great example of what we call drug repositioning. So taking a commonly prescribed drug, which is widely available, relatively inexpensive, and developing new applications for it.
So doctor, if someone at home is watching and has ovarian cancer, or someone in their family has ovarian cancer, what would you say if they're hearing this, about, wow, that might be a drug that I could use? What should they do?
They should talk to their physician about it. They should talk to their oncologist about it. What happens when we have these types of retrospective studies where we notice associations, we then begin to develop what we call prospective studies, looking forward. So one can imagine that metformin may be combined with the common drugs that we treat ovarian cancer with in the future when women are first diagnosed, or it may be used to try to suppress the cancer from reoccurring. So women, once they've been treated for ovarian cancer, you can imagine studies which will be developed in which the metformin can be used to prevent the cancer from coming back, perhaps. So stay tuned for more.
Good news.
Yes, very good news.
Great news.
Dr. Elizabeth Poyner, great to see you. Thank you so much. And